This is the Exercise Psychology, Psychological Factors and Major Issues by Megan Taylor. Culture. The culture of society, coaches, sport, and family can take a toll on an athlete's psychological well-being. Culture for athletes. Things like "you're fine" and "suck it up" culture can diminish an athlete's gut feeling of what to do after getting injured and if they should tell someone. This culture can also affect how an athlete deals with mental health struggles. Should they tell someone and get help or not? Athletes who are out of their sport due to injury may try to rush their rehab so they can return to play and please their families and coaches. How parents talk to their children after, during their performance can have a negative or positive effect. Parents talking to their children during or after their performance can affect the child's confidence and base their worth on how they performed and how their parents thought they performed. Injury. Injuries can cause a person to feel disconnected from their team. They can be obsessed with how to return to play quickest. They may try to rush their return to play to please their coaches and family, and in turn can make their injury worse. Forced retirement. Forced retirement is being cut from a team due to lack of performance or injury. It can have a huge toll on the psychological well-being, good and bad. The negatives of forced retirement are bitterness due to the situation, loss of relationships with teammates and coaches, loss of self-identity because their identities were tied to their sport. They think, "Who am I without my sport?" Lack of confidence and ability to go through daily life without their regular sporting schedule. They may also be unable to find something that gives a similar feeling to what their sport gave them. Some positives, however, can be having more time with families, less stress and pressure of performance, less stress about winning or losing, and more time to pursue hobbies. Stigma. There is a stigma supporting the world for all athletes that has been brought to light in recent years. This has helped society become more aware of the struggles of athletes, and campaigns have been made to change the societal view around athletes, and mental health is starting to change. The stigma of being seen as weak for seeking help for psychological issues is one of the reasons that athletes may not try to get help. The outside world. People looking into the world of a college athlete may see it as an opportunity with perks and privileges. Athletes may feel that they are ungrateful for what they have compared to others. Mental health takes a toll no matter if they're performing well or not in their sport. Mental health in athletes. Elite athletes are more susceptible to mental and physical health issues compared to the general population. According to a study, The Mental Health of Elite Athletes, a narrative systematic review, the data from the studies reporting larger samples, although limited in scope, suggest that elite athletes experience a broadly comparable risk of high prevalence mental disorders. In one of the tests, depression, there were 27.2 who experienced this. For eating disorder, it was 22.8%, and anxiety disorder and social phobia, there was 14.7%. Youth athletes and high school athletes also have various psychological factors as well. All levels and ranges of athletes have a range of stressors, such as anxiety, sports performance, overtraining, public and media scrutiny, substance use, eating disorders, and body dysmorphia. Stephanie Coakley, the Senior Associate Athletic Director for Mental Health, Wellness, and Performance at Temple University, states that being too busy to get enough sleep because of rigorous schedules and the risk of low self-esteem if the student athlete does not feel that they are good enough for their coach or team. Burnout. Burnout leads to physical and emotional exhaustion. The pressure to win and train year-round with vigorous intensity has increased dramatically in recent years. There used to be separate seasons and off seasons for various sports, where now one season leads into the next, leaving little time for rest. This pressure can lead to overtraining and burnout. This can lead to feelings of low personal accomplishment, low self-esteem, failure, and depression. The Coakley model believes that burnout, especially in younger athletes, is related to social organization of high school performance. In sport, burnout occurs because the structure of high competitive sports does not allow youngsters to develop a normal identity. They don't get to spend enough time with their peers outside of their sporting events. Young athletes focus on and identify almost exclusively with success in sports, and when they have injury or lack of success, the associative stress can ultimately lead to burnout. Body image, dysmorphia, and eating disorders. Athletes all ages are at a greater risk of eating disorders due to the pressure to achieve a body composition that will improve their sports performance. Teachers and coaches should educate and inform athletes of healthy eating habits. Perfectionism. Perfectionism in athletes can come with a particular tenacity for student athletes, said Tommy Frintz, a sport and performance psychologist. The demands are high, and then if you're trying to meet those demands perfectly or perform perfectly in all those areas, that can be a real problematic recipe. In a study, researchers examined 256 adult athletes, men and women. They competed in a variety of sports and were asked to fill out a questionnaire about their perfectionism, perceived stress, failure, and burnout. These results showed that participants who are always obsessing over mistakes or those with higher measures of self-critically and perfectionism suffer more stress and burnout. In facing greater psychological difficulty, they mentally disengage themselves from their sporting activity and their performance suffers. Suicide. In March to April 2002, there were 5 athletes in the NCAA that committed suicide. For younger athletes, high school, there was an increase of mental health issues from the pandemic occurring and sports being canceled. Young athletes tying their identity to their sport caused them to suffer mental health issues. For anyone experiencing suicidal thoughts or mental health crisis can dial 988 on their cell phone. Victoria Emma. She is an example of an athlete struggling with her mental health. Even though she was being recruited by colleges and traveling all across the country, she was secretly struggling with her psychological health. She is now a professional tennis player. But as a high schooler, she described her social experiences as being all about tennis. Whether she was performing good or bad in her sport, she didn't know how to handle it. She states that even when it was going well, there were people that all they talked to her about was tennis. Her parents said that they had no idea of her struggles until they found suicide notes in her bedroom and got her the help she needed. Other cases. Cases have presented similar to Victoria's that didn't end the same. Katie Meyer, Sarah Schultz, and Lauren Burnett, all successful in their sport, secretly struggling with their mental health and lost their fight with it all a couple months into 2022. Being aware and knowing the signs. Leveling off, diminished performance, including strength and stamina, chronic fatigue. Psychological signs are higher resting rate and blood pressure. Cognitive issues like difficulty in concentration, diminished schoolwork, and forgetfulness. Illness as a result of suppressed immune system. Emotional issues like distress, moodiness, and irritability, and low self-esteem, increased anxiety, and depression as a result of falling short in the sport's demands. Athletic trainers can help identify and preventing the athletes through an awareness of the signs and symptoms. and communicating with coaches and staff so that they can create a plan to help them rest and get better. How to help. Effective coaching, which is a huge importance because coaches play such a huge role in an athlete's career. They need to adjust their methods to the age of the athlete. For example, don't treat Little League like a college game. Role of parents. The role of parents can also provide a huge role in an athlete's mental health. The environment parents provide in their child's sport can have a positive or negative effect. Encouragement and criticism needs to have a balance. Pressure to perform based on positive interactions and what parents will think can put immense pressure on young kids. And this is why we all need to be aware of how to deal with psychological health issues. That way the stigma is gone and athletes can get the help that they need.